Welcome again to another broadcast here in the Issues Room. Tonight is our 148th edition. We'd like to welcome you, our viewers, all over the world, wherever you're picking up signal. We say thank you for joining us, irrespective of your time zone. We just want to say welcome, welcome, and welcome. We encourage you to join us here tonight, but share the link because this conversation tonight is very important to the future of our country. And we'd like to have you be a part of the conversation. You have the opportunity to chime in the chat room and even send out some of the messages, things that are burning on your mind to share with us as we broadcast here tonight. You also have the opportunity to call in. So we want you to invite others, make this broadcast tonight one of the most rather attended broadcasts. This evening, we say thank you for all you do for the Issues Room, finding the time to join us day in, day out when we come here on Tuesdays and Fridays, 7 p.m. Eastern Standard Time. This evening conversation will, of course, be about the youth of Liberia. We have one of the premier psychiatrists in the country, in person of Dr. Moses Ziah II. He will be joining us here very shortly on this broadcast from Liberia. In fact, he is the one heading the mental health institution in the country that is under the John F. Kennedy Medical Center and the Ministry of Health and Social Welfare. We're also expected to be joined by Dr. Bartum Kulah, who is currently based in Atlanta, Georgia. We expect him to be here this evening very shortly. In the meantime, let me bring in my colleagues here in the house, Moses Sandy and Alphonso. Gentlemen, it's Tuesday, the 25th of April. Just like that, April is about to dissipate in thin air, and we'll be looking forward to the month of May.
Yep. Absolutely. April is gone. April was my birth month. Celebrated privately.
Yeah, you didn't even share with us, but I like I like that.
Oh no, my man. I think on the man has to pay fine. You didn't share with the issues wrong, but we
I
want to
will.
say happy birthday,
Thank
happy
you.
belated
Thank you.
birthday, Alfonso. Again, today we have come. Let me join Volcano in telling our many viewers out there to please help us share the link, invite more people because the discussion tonight is very, very critical. You can afford to miss out on this. Please share the link. Volcano, Alfonso, it's good to be in the house with you
Definitely.
guys.
Thank you all guys. Once again, this is a very important topic just to kind of emphasize what you both said. The youth of the country, as Talbot said, is the precious jewel. And as we all know, we refer to it as the future of the country. And when the youth of the young people of a country are impacted, the future of the country is doomed. So it's a very critical topic.
Any thoughts?
Um, Volcano, real quickly, Dr. Zia is asking you to share the Facebook link with him.
Okay, one of you should please do because right now I am.
Okay.
I will do that probably at some point, but right now I'm in
Yeah.
the space.
Okay.
Yes.
Yeah,
But,
he has it in the chat. Yeah. So
but the link is down at the bottom. So
no, it's his contact that.
yeah, what I'm seeing, the link is on the flyer. It's right there.
Yeah.
Yeah. But I
The
would.
issues room, when he goes to the
Yeah,
issue room, you should be able to get
I would
it.
do that. I would do that. Let's just start off with the salutation.
Yeah.
Dr. Kula is backstage. She just joined us, so we'll be coming to both of them. But quickly, man, I just wanted to say here that one of the world's iconic musicians and human rights activists, uh, Mr. Harry Belafonte, passed away today at the age of 96 from congestive heart failure at his home. He was born to Jamaican immigrants many years ago. He was with the civil rights movement, blended with Martin Luther King, and he was just a man who was highly respected in this country. He passed. He grew up in the Harlem, New York area, and two of his memorable songs are Deo and Hole in the Bucket. And in the beginning of my broadcast career at the Liberia Broadcasting System, one of those songs that I played all the time was Hole in the Bucket. a very beautiful song, a melody, and it was just cool. But he did a lot of rather a cappella as well. But peace be to his ashes. Harry Belafonte will be missed. He was one of those musicians who stood the test of time, especially during the civil rights era here in the U.S. I'd like to welcome Mapu Hall, Fergie Monyu, Lamin Tai, Samuel Abu is here with us tonight. Thank you for joining us. Alexander Sompon Jr., we say thank you for joining the Issues Room. Continue to share the link, invite others to join us here tonight. Gentlemen, our studio guests are here. I think we should just cross over and bring them in because we have a lot to cover tonight. Let's bring in Dr. Moses Ziah II, uh, Liberian psychiatrist who is currently in the country, and he's one of the people that dealing with everyday mental health. He said, "Welcome, Doc."
Thank you very much, Mr. Shelton, and the rest of the panelists over here. It's nice to be here on the platform. I think my second time or so. Thank you for having me.
Thank you, thank you. And then we'll go over to Atlanta, Georgia, where our other guest, Dr. Bartum Kulah, MD, MBA, senior. Put it the senior there so we can distinguish that. Welcome, sir.
Thank you. Thank you. I have a junior, so I'm getting used to putting the senior on there. He's in college now, so he's got to be in the legal system and all of that.
So we reached out to you guys and wanted us to just talk about what is happening in Liberia with our young people. We see a lot of people, young people rather, doing social drinking. They're all out there. They're doing other things that are negative to their future. But social drinking and also the use of drugs as a result of such negative vices being practiced or displayed by them. Thousands and thousands of them have ended up, in camps considered to be zobo, as is considered in the Liberian layman term. And this has become, you could say, a pandemic. Another person could say an epidemic, whatever it is. But let's start with Dr. Ziah, who is firsthand on the grounds, just give us a quick overview as to the hospital you work at right now. What is the capacity of this hospital and how is it catering to the young people? Let's just start with that first, and I know my questions will come.
Volcano.
Yeah,
May I just suggest something quickly? If we could just give two of them the opportunity, at least 2 minutes each, to let our people know who they are and what they do, then we can delve into the discussion. You know. So, if you mind, Dr. Zia could just start. Talk to us briefly about himself.
Okay. Once again, good evening to all the listeners and to our fellow panelists. My name is Moses Ziah II. I am a psychiatrist. I am currently one of three psychiatrists in Liberia, and I'm the youngest. So, just to correct the statement made earlier by Mr. Shelton, I am one of the psychiatrists at the ES Grand Mental Health Hospital, which is the only hospital, only mental health hospital in country. Okay, I'm there with two other psychiatrists who are my seniors, Professor Harris and our consultant, Dr. Ojediran, who is a Nigerian. So I am glad to be on the platform and thank you.
Thank you, sir. Yeah,
Good
Dr.
evening,
Kulah.
everybody. I'm Dr. Bartum Kulah, family medicine practitioner by practice, by training. I do a lot of consultancy, I would say, with healthcare in Liberia. In fact, I took a psychiatrist to Liberia in 2010. And during that time, we didn't have Dr. Ziah and others working there. And we felt that we needed to get more doctors involved in psychiatry. And hopefully, with the help of the international community, they started a training program, I believe, in 2013. And Dr. Ziah was one of those who was trained as a psychiatrist and now working at ES Grant. But at the time when we went to ES Grant, It was pretty sad. There was no psychiatrist there, so all of our nurses were the nurses and the PAs were the ones treating our patients. And the psychiatrist that I took there that day had to go ahead and do chart reviews and put the patients on the right medications and whatnot. So I'm glad that we at least have 3 psychiatrists in country working at ES Grant. So it's good to be here.
Thank you. Go ahead, Volcano.
Go ahead.
So, real quick question, if I may come in,
No,
just a really quick question. Where's ES Grand located?
Well, ES Grant Mental Health Hospital is one of the components of the John F. Kennedy Medical Center right now. It used to be a private practice clinic owned by the late Dr. Edward S. Grant, who passed some years ago. So after he passed, it was used by an NGO. It was operated by an NGO for a little while, and then in about 2010, it was turned over to JFK because at the time there was no other mental health hospital in the country. And I'm sure you know that back in the days there used to be a mental health hospital, a full-fledged mental health hospital called Catherine Mills, but it got destroyed by the war, and so ES Grant was the facility available and then later turned over to JFK.
So it's
So
ES Grand.
it's located in Painesville,
Okay.
around the Dupo Road belt.
Okay. 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 But it's attached to JFK. Is kind of
Right.
abroad.
It's one of the components of JFK.
Okay. Thank you. Guys, if you want me to continue, I can keep
No,
asking.
Volcano, you ready?
I told you to go ahead.
Oh, okay. So, on that, first, I know tonight the discussion is on mental health, substance use, and all of that. Help our audience. A lot of people, when they hear medical doctors, when they hear psychiatrists, their perceptions are quite different. And you guys are the one in the business. Draw the dichotomy between a medical doctor and a psychiatrist. Dr. Ziah, clearly tell us what is the role of a psychiatrist in regard to mental health. And Dr. Bartum will tell us who is a medical doctor and what a medical doctor does.
Okay. Thank you very much, Mr. Sandy. So a psychiatrist is first of all a medical doctor whose specialty is mental health. So in medicine, we have a number of specialties and subspecialties and the likes. Family medicine, for example, is one of the specialties of medicine. So you first have to become a medical doctor, which I am, before going to specialize in any field. So pertaining medicine about the brain, we have basically about 3 major disciplines in medicine, which are specialties that deal with the brain. So we have neurology, it deal with the brain, treat diseases of the brain that do not require operation. And then we have neurosurgery, and those are also doctors with that specialty who provide care for the brain, but in this case, they provide care relative to operations, all right, surgeries, trauma, and the likes. And then we have the third group, which is the psychiatrist. The psychiatrist is the medical doctor who provides care for the brain, but the care we provide has to do basically with malfunctioning of the brain in relation to behavioral disturbances. All right. So we work in between the neurologist and the neurosurgeon, and we treat the behavioral issues associated with a mental illness, whatever it is.
And is it done through chemical means, like medication prescriptions and stuff like that?
Well, our treatment model is rooted on what we call the biopsychosocial approach. So we have the biological component that we treat, and if it requires medication, we give it. Okay, we have the psychological component we treat. If it requires psychological interventions like other forms of therapy, we provide. And then it also has the social component wherein we blend in other support
Like
underlying
you mean
whatever.
treatment? You mean like treatment, groups counseling, and stuff like that?
Yeah, when we talk about the use of medication is just one component of our treatment modality, and that's the biological component. If we feel that the person has a disorder, that is at the level that requires medical or what we call pharmacological treatment, then we provide medication. But all that we do, the three components are tied together. They are inseparable.
Yeah, that you
And I
spoke
think
a very.
let me
Oh,
just throw in
yeah.
something
Go
real
ahead. Yeah,
quick.
yeah, yeah. Go
What
ahead.
I want to tie in with what he's saying is I think where a lot of people get it confused is that you also have a psychologist or therapist, a licensed clinical social worker that works along with a psychiatrist. So if they need behavioral therapy, they then go to the psychologist, PhD in psychology, that will do various therapies and whatnot. But Dr. Zia would probably be more or less prescription medication, and he can also do a lot of the behavioral therapy and whatnot as well. But he will probably pass it on to the therapist if
Yeah,
that's needed.
absolutely. And you're very correct, Dr. Barton. Uh, but then here in Liberia, we do not have psychologists. We don't have a lot of psychologists. We have very few who provide some service. So you know that the training of a psychiatrist is comprehensive and includes some, psychological treatment. You learn all of those things. So we provide some of them. And if we think these people need specific therapy, more structural therapy, then you're right, the psychologist. And if we had psychologists here, we will work with them. If we had a number of them, we have very few that we'll still work with. But here in Liberia, you do a lot, because you don't have too many people with subspecialties on the team.
But and that brings me to the thought process here that a lot of folks leaving here with just masters in psychology. Uh, in America, they wouldn't be considered psychologists. They might be considered, clinical clinicians and what have you. Because to be considered a psychologist, you must have a doctorate degree, a PsyD or whatever. It could be a philosophy degree in psychology. Who are some of the psychologists you have on the ground? Are they calling themselves psychologists because they came from America with master's degree? What is the portfolio to think to lay out here?
Well, I wouldn't speak much about qualifications and all of that, but I do know that psychology is a field, clearly, it's a field of science
Discipline.
that you do at bachelor's level, you do at master's level, and you do at PhD. Of course, at PhD level, you are at the peak, and so you are well versed. But we have people who do clinical masters in psychology. They are psychologists, they provide care, in clinical settings, and I know they have some subspecialties in the field of psychology as well. Like they have, people in different areas. But yes, we have few psychologists here. We have someone who has a PhD, I'm told, has a PhD in psychology. He's providing some services.
He's there too.
Um,
You see,
Of course.
and
okay.
we have another person who got his master's in clinical psychology in the Philippines. He's here in Liberia. He was in our practice, but he recently started working with another NGO. We have another person who is completing her training. She's been doing exceptionally well. So of course, we in Liberia, among the courses offered at the university, psychology is not provided across. So they do sociology, they do social works, and social workers are now being trained at master's level, but we do not have a clear psychology program in Liberia. So you see that there's a major gap over there. So now there are people who come, with their training, and then they're providing some care. But again, in the absence of all the specialists, those who are available always do a lot more to provide the care. And if we remember, like Dr. Barton said, before 2013 in Liberia, we did not have specialist training. All right. We didn't have any postgraduate medical education in Liberia. And that was in 2013 before they started offering that. So I think the first group graduated like in 2017. And before then, there were medical doctors, general practitioners who were providing care, whether it was optimum, unlikely, but they were providing care until then. So the same way, we have a team of people providing care um, until we can get there.
So
I think
help
Moses,
yeah.
Moses,
Hmm.
let's
Hmm.
move away from credentialing and come to the crux of this conversation. In the beginning, I talked about the situation with the youth and the use of drugs and the impact it's having, and also those who are, drinking socially all over the place, drinking spots. I think let's start from there, Moses, if we want to continue.
Yeah. Okay. I just wanted to know from the dad, uh, Dr. Zia, do you in I'm told in mental health you guys treat disorder, right? When
Yes,
an individual is diagnosed, the person diagnosis is considered to be a disorder. Explain for the Irishman what is a disorder, and
okay,
in mental health.
okay. The concept of disease and disorder, there's
Hmm.
a long history of that. But
Yes.
just to quickly wrap what you're asking, it is said in medicine that diseases are known to have clear either structural or functional aberrations or changes within the body that you can directly identify.
Okay.
So they tend to classify them as diseases. So
Okay.
there's a clear defect that you can identify. All right.
Okay. Hmm.
And then they also say disorders are ones that you may not identify the clear either structural or actual physical defect, but there is a malfunction. Now, this concept is back in history. I mean, it's something that was discussed back in history. But even that concept of mental disorders not having a clear either physical or functional change noticed in the body has changed gradually. That concept has changed because with the involvement and development of technology and everything, what used to be known as just a brain malfunctioning that they did not know the cause for is now different because all mental disorders have now been identified to have a clear change, a clear functional change, even if it is at the molecular level, if it is at the
I think
cellular
you're more
level.
scientific now, Dad.
Yeah, no, I'm just
Yeah,
saying
well,
now
yeah,
that
ask him.
Yeah.
these days,
Hmm.
all the mental
Yeah,
disorders that
ask
we
him.
treat have now been identified to have some kind of cause that we can
Okay.
identify. Before then, it was known that these disorders didn't really have a cause, so we used to call them disorders, like something not functioning properly. And those for which they had the clear cause that they identified, they used to call diseases.
Okay.
So that used to be the difference. But basically, although in psychiatry we still use the concept disorder, but clearly the cause of these changes, the cause of these malfunctions are now being identified, contrary to what used to be known years ago. So disorders, diseases, almost all the same in layman term.
Let's hear from Alfonso.
Yeah,
Yeah,
Francis.
so thank you, Volcano. So I have a few questions, Dr. Zia, and maybe Dr. Kulah can get in as well if you know. So one of my questions is that one is ES grant an inpatient facility, as I'm sure you all know as doctors, and then give us an idea of the volume of patients that you see on a regular basis in Liberia at ES grant.
Okay. So on a regular basis, we have clinic days specifically. or 3 days a week we have clinic, and on the average we'll have anywhere about between 10 to 12 patients, new patients presenting to clinic. 10 to 12 new patients on a regular clinic day, and we have that 3 times a week. But then beyond people coming for to clinic, we also have people presenting with emergency issues. So sometimes 2, 3 on the average. But then we have a pool of patients who come in regularly, who are known patients of the unit. They come for refill, they come for follow up, and that number can be on the average anywhere from 25, 30 there about on a daily basis. Our inpatient facilities capacity is about 75 to 80 beds. And like I said, that's the only inpatient hospital in the country. There is another facility that has been like a continuity care kind of place that has been functioning along with the ES Green. Is owned by the Catholic Church. It's called the Step Down Unit somewhere in Pinsville too. The maximum capacity for inpatients is about 24. Usually they have anywhere around 19, 20 patients all together all the time.
Do you believe that you at ES Grant and maybe that step down facility being run by the Cal House, do you believe that the services that are available in Liberia are coming anywhere close to addressing the mental health needs of the country?
But Alfonso, quick, I want you to clarify. He talks
Yeah.
about patients. Are
Moses,
you?
let him
Yeah.
just answer that question.
Okay. Yeah. Okay. Answer. Yeah. I was
Well,
just following up on the question that
right.
Alfonso asked.
The answer will be no. The answer will be no because we are in Monrovia.
Okay.
Okay, we're in the capital. The capital right now has about 2 million plus people, and then the capacity of the hospital is maximum about 80 patients, and that means full capacity, 80 patients, 80 beds. And the other facility, 24, 20 thereabout. So we're talking about 100 beds for a population of over 5 million people. Now, other counties like Nimba County, Grand Bassa County, Bon County, and other areas around the rest of the country do not have hospitals. And we have patients coming from those places to Monrovia. And there are only few patients who are able to come or whose relatives are able to bring them. So certainly it's way, 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 way beneath what is ideal to cater for the country.
Mhm.
So,
Let me just say something.
Not to leave
yeah.
Dr. Kula
Can I
out.
just say something real quick?
Yeah.
No, you're not leaving me out.
Right.
The issue is Liberia, and that's why I wanted Dr. Zia to be on here because he's involved with the patients directly. I will chime in and I'll answer whatever questions you have. But my concern is I've been seeing things being popped up on the screen, and like I told Volcano, it's more than just coming here to these shows and talking. We have to go beyond that and find solutions. Both you and Sandy, just for full disclosure, if you're in the social work field or in the psychology field, this is a show where you let our people know, and then we find out how you guys can partner with Dr. Zia to make that facility better. Like somebody put on the screen that they went there, and Dr. Simmons saw that there was no psychologist in the country. Perhaps Dr. Simmons can help, along with the Liberian government, other uh, international organizations, to bring 2, 3, or 4 people that have done masters in Liberia over here, let them get their PhD and go back home and help improve the place. But we just sit here and we criticize, and we don't realize what these people go through. They don't have the resources that we take for granted here in America. These Americans made their system what it is. It's up to us to make our system to be comparable to those on the west coast of Africa, or even with America. So that's what I wanted to chime in real quick. But you can go ahead, Dr. Zia.
Look,
So, Moses,
Dr. Kula,
Moses,
quickly. Yeah.
I wanted to just throw this in since it was just in the link that was on with
Okay.
Samuel Abu. Samuel Abu is asking whether you believe, Dr. Zia, that the current health situation in the crisis, I mean, in Liberia,
Yep.
is at a crisis level now, especially in terms of symptom, meaning the mental health.
Well, we know that we have a serious substance abuse crisis globally, not just in Liberia. Everywhere in the world right now, substance use is alarming, is rapidly a growing public health problem. And so Liberia is not left out of that. The problem with Liberia, in addition to having the crisis or having the public health crisis or problem, is that we are not providing care. Okay, so if you have a number of people who are becoming addicts every day, or who are becoming substance users and abusers every day, and you do not have a pool of those people getting standard care to recover from that, that means the number is only
Going up.
increasing. All right. And prevention becomes a problem, because even treatment is a form of prevention. And when you treat one, substance abuser who comes out, there are a lot of trickle down effects, will help a number of other people to come out. So although there are services being provided, they are not the best. And as a country, there is not a national program, yet at this moment, that is providing such care. There is not a national rehabilitation center at the moment that's providing such care. All we are providing is some care, not optimum, but some care, and some people are coming out. Few individuals, few organizations are providing some services. Some people are coming out, but it is not at a bigger scale. It is not at the national scale. So that is that we're having, in addition to the fact that, yeah, the number is increasing. Drugs is readily accessible and available, and a pool of young people are trying drugs on a daily basis, and a lot of them are getting hooked.
So, that I wanted you to provide this clarity for us. When Alfonso asks you about the number of patients you guys see, are you talking about individuals with psychological or mental health problem, or you just speaking in general, including, are you including individuals with medical problems and individuals who are emotionally
Really
disturbed?
strictly psych, I believe.
Is that what you meant, that when you see 80
So
persons in a week or so, are you talking about individuals who have mental health problems, and others who also have medical problems, or you were speaking specifically about individuals with mental health problems?
okay, I was speaking specifically about individuals with mental health problem. So, like I
Okay.
said, it is the only mental health hospital in the country.
Okay.
So we
Okay.
psychiatrists, we are more like neuropsychiatrists. We treat neurological disorders, we treat mental disorders, we treat substance use disorders.
Okay.
So a grand hospital provides care to all of those people, including people with epilepsy, seizure disorders. We treat them mostly at Grand Hospital. There are
Okay.
other general hospitals that provide some care, but we tend to treat a lot more of the population, with seizure disorder. So yeah, that's the group. Remember, I said ES Grant is a part of JFK. So the Memorial Hospital, the maternity hospital, they treat other conditions. But if there's anything related to mental or behavioral issues, then they refer to us, and then we treat.
So real quickly, so we do hear about. I mean, Volcano mentioned that from the beginning. Social drinking, substance abuse issues. We do hear about a lot of young people, especially in the Monrovia area where you are located, are referred to as Zogos. They use drugs. They are, etc. Does your facility have an outreach program to that group of people, or do you basically wait until they present themselves at your facility before they can get care? Or are you aware of any other outreach program in the country to that population?
Okay, thank you. That's an important question. So there's the Ministry of Health, that of course is the health body, the health agency of government. They have a mental health unit that is responsible to champion and implement mental health programs. So those mental health programs championed by the Ministry of Health through the mental health unit, include programs that are targeted at, prevention, health promotion, and a lot of other things. But also we have the curative arm of the Ministry of Health, and there were the hospitals, and the health facilities for in that case. So as a health facility, JFK is providing care. We are mostly towards the curative arm. So when people have diseases, they present to the hospital and we treat them. But as doctors, as psychiatrists, we see clearly that our work goes beyond just treating. So we are health promoters, we are, patient advocates, we are counselors, we are everything. So one of the programs we have now in Liberia at Grand Hospital, ES Grand Hospital for substance users is a kind of hybrid. It's a mixed program. It's not the best, like I said. It's a mixed program. So we have an outpatient counseling clinic. All right, and you should know first of all that the treatment of substance use disorder is wide, is varied. There are a number of options you can use. They have the outpatient programs, they have inpatient programs, which are residential programs. They have, self-help groups, they have replacement therapy. There are multiple options available out there. What we do is a little mix between outpatient program and a little bit of inpatient program. So we allow substance users to present themselves, or they get recommended by their relatives, or they get brought in by their relatives at Grand Hospital, and then we enroll them in an outpatient counseling section to establish motivation, to help them with the stages of change and all of that. Now, and then to also give them, help as it relates to coping skills, mechanisms, and all the measures that will help them to quit through mostly psychoeducation and psychotherapy. We provide that outpatient counseling for a number of weeks, and we usually allow the patients to.
Oh, he's frozen.
Oh, big
Uh-oh.
He might.
Okay, Dr. Kula, you can come in and then later
Yeah,
you can.
Dr. Kulah did
Yeah.
put in a
What?
number of things. He talked about seed program. You talk about 13.9 million, etc.
Yeah.
So you
Quite recently, the president of the UN established this $13.9 million fund that's supposed to go into helping rehabilitate a lot of these kids that we call Zogos, well, disadvantaged youth that are in the ghettos, so to speak, where a lot of the substance abuse, substance use disorders occur. And because these things lead to a lot of problems down the line in the community, in the society, I believe there's been an intervention with this group called SEED, Social Economic Empowerment of Disadvantaged Youth, that they actually go in and engage these kids. And of course, you guys have heard about what recently the Senator Darius Dillon established his facility to rehabilitate these youth. I was hoping that instead of making it a personal thing where he just creates one, uh, you know, facility to help these youth, I was hoping that he would make it something that would be by law that each district or each county would have something like that, where a lot of our kids who were first drugged during the war, and then after the war, a lot of them are getting on the marijuana, the heroin, the cocaine, and other things for whatever reason, the alcohol, for whatever reasons, and it's creating a lot of social problems with the rapes that you have in the country, a lot of the armed robbery and all of that. I was hoping that it would be a solution throughout the country instead of just a one-off thing or personal thing that we always do in Liberia for some reason.
But look, let me just come in quickly on that. I would say, what the senator has started, I think it's a laudable initiative, somewhere to start from. I don't think it's really centered around here. Uh, we have a Ministry of Health, and one of the fundamental responsibility of any government is to care for its people. And the government has not really stepped up to the plate. It is my understanding that in terms of budgeting, 2022, the Liberian government allocated $30,000 for mental health. So that tells us that the government is insensitive. Okay, so help us as a medical doctor who follow these things on a consistent basis. How profound is this problem in Liberia? The issue of substance use, how profound it is, how and also help us understand uh, the implications. How is substance use affecting the lives of our people? And what are the causes of the problem? So I'm giving you three questions in one. Tell us
Well,
the causation of this problem, or the implication of the problem, and how profound the problem is.
I've already touched on some of the causes, implications, and whatnot, but I think I didn't go into how profound it is. I mean, for
Yeah,
one thing, you guys should realize that our population is between the ages, I would say between the ages of 15 to 36. I think it's a high number of our population, maybe over 50%, maybe 79%. I think the last that I read is in that age group, and so
63% or more.
63% right now.
Yes.
But
Yeah.
okay, but it's in that age group. That's a significant number of our population in that age group, and a lot of them are engaged in the substance abuse, substance use disorder. I was just reading an article where they did research in schools. It's starting in the schools where the kids are drinking alcohol in school, going to school and disturbing schools, being kicked out, and then ending up on the streets. The marijuana, putting marijuana in kaya and eating it at schools and disturbing the schools and being kicked out. And then going, of course, living on the streets, getting involved in other drugs like the heroin. You got the girls getting into prostitution. You got the guys going into armed robbery so that they can feed that habit. You got people raping young kids because they're on drugs. That's the prevalence of the rapes, and all of the social ills come as a result of this substance abuse disorder. And so it's a serious thing. And it's sad that our government hasn't taken it serious enough to put enough money in the budget. But my brother, you have to understand that the kind of government that we have is more or less like the American government. So the legislators are supposed to check the executive, right? They're the check and balance. So if the executive doesn't put more than $30,000 in the budget, it's the Dillons and the others in that Senate that's supposed to sit there and say, look here, man, we came out of war. We have a serious mental health crisis on our hands, substance abuse crisis on our hands. 30,000 is not enough. We can't sign this budget and pass it into law if we don't put more monies into the budget. And I think that's where all of us as a people have to be involved. We cannot let these guys slide because they're our friends or because we feel like they are the light and everybody else isn't. Let's put pressure on all of them. And I think if we do it collectively, where we're putting pressure, those of us in the diaspora putting pressure on them, and we get our people in Liberia to put pressure on them, some of these things will not just pass like that. But we sit back, we have these discussions over and over and over again, but we never have a plan for how to implement or how to bring solutions to the problem. I think that's some of the issues that we need to deal with. We need to deal with solutions.
What
And if
solution
I
have you
may,
put forth, Dr. Kula? What are some of the solutions that you have put forth for resolving some of these problems?
I just put out one just now that we in the diaspora should put pressure. The people that wanted the dual citizenship issue done, they put pressure on the legislator to pass that dual citizenship issue. So Wetty is going all around the world. He's happy about the dual citizenship issue. Some of you are in social science. People writing here, Dr. Simmons, others, they go on these medical missions. You can't just go on medical missions and feel happy because you went on a medical mission. You come back to America and criticize what's happening, but you don't go and find a way to solve the problems of what's happening. So right now, I would suggest to you, Sandy, I don't know if you're in social science or whatever your background is, Alphonso, whatever your background is, liaise with people in Liberia. Dr. Ziah is here. He's open to everybody. He gives his number out. Liaise with these people and help them solve some of these problems. We can't just be about complaining without solving problems. We have to solve those problems. We have to get involved. To whom much is given, much is expected. We in the diaspora, we have jobs, we have incomes, we have knowledge, we have networks. Use your network to make changes. I use my network. The friend that I took to Liberia when there was no psychiatrist there, she was supposed to go to a conference in China. I convinced her. I said, "You got to come to my country. There's no psychiatrist in my country. My country is just coming out of war. Let's go home." That lady paid her own way, and I brought her to Liberia. We were able to put her up at the time, but she paid her own way. She came to Liberia, and at the time, we had a plan for getting psychiatrists in Liberia on a rotational basis until things would get to where Dr. Ziah and others could take over. But again, our people on the ground sometimes do not work with us for whatever reason, but still we have to be there to keep pushing. So yeah, when I say we have to give solutions, I'm not just talking. I'm making sure we're finding solutions to these problems, and y'all got to do the same. We can't just be about talk. Got to put our money where our mouth is, and we got to put our actions where our mouth is. Really believe in these problems. Let's put our efforts behind it. We have Liberian organizations in every single state in this country, right? Our Liberian organizations have to be more about changing things in Liberia than about being into the politics of it all. Yeah, politics is good, but what good is politics if you're not changing the very issues that you discuss all day long?
But
Thank you.
let me just quickly tell you that when you make changes, that's politics. And, so let's be clear about that. When people speak to the contemporary issues, they are raising these issues because they matter a lot. So when you intervene to resolve some of the problem, it's the
Mhm.
same politics. It's the same
I didn't say it's
politics.
not. I'm
Yeah.
saying let's not
Yeah.
just be about
Mhm.
talking. We talk more than we make things change. Let's make change. Let's make things happen.
Go ahead,
Let's not
Volcano.
just talk. That's what I'm saying.
Well,
So when we leave from here tonight, I want us to have some solutions and some actionable solutions that we'll put into place. That person who posted that Dr. Simmons went to Liberia and saw no psychologist there, I want Dr. Simmons to call Dr. Ziah. And I want us to leave from here with a commitment that Dr. Simmons will help us find a way to educate at least 3 psychologists that have master's degrees or working in LU. We can't just be about talk, man.
thank you.
Go ahead,
Listen,
Volcano.
we're at probably the intermission. Would like to remind you, you're here in the Issues Room, 148th edition. Here, our broadcast tonight featuring Dr. Moses Ziah II and Dr. Bartum Kulah Senior. Both one in Liberia, one is here in the States with us. We're discussing the current situation of drug use by our young people and social drinking, which also lead to mental health. Dr. Ziah, just a day ago, the American ambassador said he went across the country and he noticed that no drugs everywhere in many of the clinics and hospitals in the Leeward counties. You're running a psychiatric hospital, and I've worked in psychiatric hospitals here in America, and I know the cost of just one medication. If there are no drugs across many of the healthcare institutions, including JFK, where people are buying everything, how are you sustaining the institution? What is the budget, to say the least? Um, you know,
The hospital.
to contain this kind of serious matter, because this is not a what you call the take paracetamol kind of treatment. This is not a put drips in a person kind of treatment. This is serious matter. How do you really handle this?
Okay, thank you. Sorry I dropped off earlier. The internet,
It's
the
understandable.
network dropped. So, okay, so when it comes to the treatment of general mental health problems, Let me just make that clear first before we talk about substance abuse or substance use disorder specifically. When it comes to the treatment of general mental health disorders, we use medications that are very expensive, like you said. These medications are very costly, and the patients who use these medications are usually the destitute population because even if this person was or is rich, there is this social drift theory wherein because of mental illness, the person's social status is going to change. And a number of these people who have mental illnesses, they cannot work. They are not, many of them cannot be productive, especially when they have chronic mental illnesses. And because of that, they depend on relatives. And these medications are expensive. So it becomes a problem. It becomes a serious problem. What we've been blessed with, however, is the fact that we've had a number of organizations who are bringing in free medications for people. So MSF, for example, has a mental health program they have in Liberia, and then they bring some medications for their own clinic and for their own patients. But every now and then they share with us,
That is not
ESBN Mental Health
sustainable.
Hospital. Okay, JFK as the hospital also procures medication from time to time. But many of the patients cannot really afford because these medications are expensive and the cost of living is difficult. And these people we're talking about, they are that very vulnerable group. So JFK brings medication and they have to sell that medication for far less than what they even spent to purchase the medication. So there's a loss. Okay. However, the leadership of JFK through connections and network have been able to secure some medications, from some partners in the US, and then we've been using those medications. Some of the medications are available in private pharmacies, commercial pharmacies, and so when we do not have these medications, we go out there. We do prescriptions and patients can buy them. The most effective and I would say most effective, not because of how well it treats the disease, but how good the side effect profile is, and because of that, it becomes very tolerable, and a lot of patients would rather stay on those medications. Those medications are super expensive, even in the US. They're in thousands of dollars. Of course, we don't have those options here for our patients. So those older drugs, which still do the work, but have a little wider side effect profile compared to the newer drugs, tend to be used a lot because they are less expensive and we can easily get them. So that is about treatment of general, mental health issues. For substance use disorders, like I said, there are multiple treatment options. One of the treatment options in the West is replacement therapy, all right, wherein people who are abusing specific hard drugs, more dangerous drugs like heroin and other drugs, and they are using injectable drugs, they are injecting drugs, and that poses a lot of other health challenges to these people. The option is they are really hope they may not be able to quit the drug, so we give them a safer option of the same drug they're taking, but a better and safer option that will not cause them the social and medical problem they are having using the one that they're buying. So that is what we call replacement therapy. So there where the drugs like methadone, for example,
Methadone
comes in
comes in, yeah.
for opioids, drugs like buprenorphine, drugs like naloxone, and the likes, a number of other drugs. Even for alcohol abuse, there are some drugs that are used like replacement. We do not have those options here because even if you wanted to, even if you had the medications, there are very strict protocols needed to carry on such therapies here because drugs themselves can be abused. And if you look at the history of substance use disorder, many of these medications that are abused today came for original good medical purpose. They got abused. All right. And newer drugs, other drugs were reserved for treatment of those initial abuse. They too got abused. So you see that in the US, you have different schedule, right? Schedule one, schedule two drugs. It is because these drugs, although they are providing some help, they also have a very high risk of being abused. So even if we had those medications in Liberia, we will rather hold on to them and not just try to provide them, because we don't have the systems to prevent abuse of those drugs as well. So here in Liberia, what we are doing, and in most African countries, a lot of people are doing total abstinence through residential program, whether it is inpatient or outpatient. People use these other options, self-help programs, the alcoholic anonymous, the narcotic anonymous. All of these are options that we could use like in these settings. What we are using now, few people trying to provide, is abstinence. We take these people in, like I was saying earlier, for Grand Hospital, we put them in the outpatient counseling. And after some counseling and motivation and everything, when we feel that at least they have some level of motivation, we admit them in the hospital for a little while, we detoxify them, and then we reinforce the counseling that we are doing, and we release them. The time we keep them for not adequate, and we know because we don't have the space. And besides that, we know that substance use disorder is a chronic relapsing disorder, and relapse rate in the most effective setting can be as high as 70%. So these are people we know, a lot of them will relapse. If we had the right program, we expect a high percentage of relapse. But still, every single substance abuser that became sober is a hope that others can, and that person, impact a lot of other people, which is a form of prevention too for other people who are otherwise going to use substance. So this is the situation we have,
So let me come in with
I
this
hope
before my other colleague comes in. The thought here is that we're talking mental health, but we're talking about the relatable variables that is responsible for it. Uh, and one of the things that we continue to hear, or a few of the things we continue to hear coming out of Liberia, is people smoking, the marrow, the dry marrow from the dead bodies at the cemetery. They're smoking the halogens out of the light bulbs or the fluorescent light bulbs. They're just finding ways to get high. What are some of the common presenting, factors when you go to do your diagnosis, when you test for are the reasons why these people are becoming so ill, apart from just the street drugs, but the other, things that they're using. Well, is it true that these things are happening?
yes, that's very true. So the concept of substance use disorder, or the concept of addiction, people have to understand that it is not a behavioral, it's not just, like we say, it's not a moral feeling. It's not just somebody choosing to be wayward, or it's not just somebody choosing to be bad. Okay. Now that used to be the concept before. Now it is clearly established and scientifically proven that substance use disorder is a brain disorder.
It's an ailment.
That
Yep.
once you begin using these psychoactive substances, they cause a number of changes to the functioning of your
Function.
brain, to structural, parts of your brain, and to the structure and function of your brain. Basically, that's what I'm saying. These substances cause clear changes, and these changes now make it difficult for you to quit using the substance, even if you wanted to. So one of the things that we see in addiction is what we call tolerance. Intolerance is wherein when you are used to taking a quantity of a drug and felt a particular way, like you say, let's say you took one load, as they call it, and then you felt high. With time, one load can no longer make you high,
Yeah, you gotta
because there
go.
have been
Oh,
structural and functional changes in the brain that no longer will affect the change using that one low. So they will go to two, they will go to three, they will go to four, and they keep going up in search of that same initial feeling of high. So that's why they go on using one drug to another drug to another drug combination, and they use a lot of other chemicals only because the initial ones they were using has become tolerant. They have become tolerant to the initial one, and now they need higher drugs. So the other concept about alcohol, and Dr. Barton was talking about, the social drug.
Oh, he gone back.
Okay, so
All right.
let's. Oh, okay,
Like
he's
we
back.
Yeah,
call
okay.
it
Yeah, go ahead.
Go ahead.
Oh my God, his internet.
uh marijuana. All of these substances may be readily available and people may start trying them. Though there is no law, it's not illegal to drink alcohol in Liberia. These substances are known to be gateway drugs. And so by the time you start to use these substances, tendencies are very high that you will use higher substances. Okay? So the alcohol, the cigarette, the shisha, as we call it, the marijuana, all of those drugs are just gateway to people using higher ones like the opioid, the cocaine, the methamphetamine, and other higher drugs that people get hooked on for life. Okay, so this issue about alcohol is a serious problem. Now, we should also know that when it comes to addiction, it is not everybody who takes a substance will become addicted. Okay, and that is because the signs of addiction is clear that there is a link between biology and environment. So other people, based on what their genes are made of, like you see in the US, there are some people who have alcohol problems in their family, and it runs in their family. And once they start to drink some more alcohol, eventually they start having alcohol problems because there's a genetic component to substance
So,
abuse.
Don, let me pause you there. Are you telling us that alcoholism is inherited? Is that what you're implying?
There is a clear genetic component to
It
substance
does have a
abuse in
genetic
Yeah.
general, not just
component.
Mhm.
alcohol.
Yeah.
Any
Well,
All the substances people take, there's a genetic component for those who will become addicted versus
mhm.
those who will not. It has to do with your genetic makeup.
Well,
There are people. Go ahead.
what?
Go ahead.
Yeah, what I have read over the years and what I know is that uh, addiction or alcoholism or whatever evolves as a result of what? Repetitive behavior. Like you
Right.
talk about the changes in the brain, and which we call the serotonin. If you do one thing repetitively, and you're taking a substance, the bull you get, and the serotonin get adjusted to that, that's when the craving comes in. And when that time comes, it doesn't matter whether you're going to break into someone's store to get that money. You will do it because you want to get high. You want to drink that alcohol. I do know that there are people who come from what they call generational addiction family, meaning mom, dad, everybody getting high. And in such an environment, it's difficult for you, to live in such an environment and not taking alcohol. But to say that it's inherited, that it can be passed on from mom to son or from dad to daughter, I don't know. How
Okay.
can you
So
convince us on that?
right. Let me make it clear, and you don't need much convincing because the evidence abound
Okay,
sufficiently
okay,
that addiction has a genetic component.
okay.
There are people who have been smoking cigarette for as long as they can remember. They choose when to smoke, they choose when to quit, they go months and they don't
Yeah.
smoke and they're fine. There are people who have been drinking alcohol since. They drink higher quantity than others. They choose when to drink, they choose when not to drink. There are other people who, once they start to drink alcohol, they cannot stop. They become addicted. There are other people who have been using marijuana for as long as they remember, they are not addicted to it. The reason why there is variation is because of your genetic makeup. Okay? So anything that is genetic means there's a hereditary component to it. It means there are families that addiction run into, and there are families where people have used substances but they do not get addicted. In general, the tendency to become addicted to a drug, one is based on the genetic genetic makeup of the individual. That's
Predisposition.
one.
Yeah.
But two is also based on the substance, because there are substances that are very addictive. Substances like opioids, for example, they're very addictive. Substances like cocaine, very addictive. Substances like methamphetamine, very addictive. These substances, sometimes a single try, you will get hooked to them. There are other substances that are addictive, not as strongly addictive, like marijuana or cannabis. People can try a number of times and they choose that, look, I don't want to do this and I'm stopping. Some people can try it once, twice, they get addicted. So there is actually a variation in terms of who get addicted. But one of the major factors is the substance you're trying. And that's why the highly addictive drugs are the ones who are, that are more likely to cause addiction, including cocaine, methamphetamine, opioids, just to mention a few of them.
So if I may come in, yes, if I may come in here, thank you, Volcano. So a few things here. One, Dr. Kulah, Dr. Ziah, thank you very much. I think you're doing great work over there. There are some people, some listeners who are making comments here. So at some point, if you can share your contact information, that would be great. Dr. Kulah has been talking about that as well as a way of liaising with people to help really affect the situation on the ground, in addition to talking about it, which I must say is also a very important aspect as well, because that creates awareness and brings people on board. Having said so,
we ask a question. Let me just remind folks, because it's 807, the line is now open, 404 272 2808. Call to engage the doctor. See you tonight, 404 272 2808. We're looking forward to your engagement. Go ahead.
Yeah, thank you. So I hope that, Dr. Ziah, you can share your contact information in the chat or with any one of us, and we'll share with those people. Dr. Kulah as well, please. And Mr. Sampon has been commenting, as well as Siata. If you all can share your contact so you all as professionals can come together, that would be great as well. I don't have a question. I just have a really quick comment I wanted to make regarding what Dr. Kulah said earlier about Senator Dillon setting up this mental health center, which is great, by the way. I think anybody who sees the need and tries to address it is really important. However, I do agree with Dr. Kulah that a lot of times what our legislators and politicians do is that they actually siphon the money from the national budget that should be going to programs, give it to themselves, and then they decide to undertake these individual programs, which then takes the money away from mental health and other services, including ES grant, when in fact the budget should be going to these specialized institutions to provide the services. I agree. Should have advocated for more money to be put in the budget, for ES grant to be expanded, or for more facilities to be extended around the country, instead of opening something in your own name. I think they're using people's money to campaign for themselves.
Look, Alphonso, quickly, let me come on that. We do not have the evidence and to support that Senator DeLong or lawmakers in Liberia are using the people's money to set up institutions to promote themselves. We do not have the evidence.
We have evidence, Moses, to give themselves 13,000, 15,000 every quarter, and development funds. They give themselves development funds.
Let me complete my thoughts,
funds
Alphonso.
to be going to health, like ES grant and those things. So there is evidence.
Let me complete my thought. So the point I was driving here is that the initiative by Senator DeLong, I would say, is laudable.
It is.
We do not have the evidence to show that he diverted, state resources to set it or to promote himself. That evidence does not exist.
So Moses, quick.
Okay, sure. Yeah.
It's not there. So it's not a matter of evidence. The ambassador just spoke of what he's seen across the country. He mentioned the very legislature.
No, but okay. And let me come to that.
It's part of the lack of doing their job. I'm coming now. Doing their job to
Yep.
ensure that the Liberian people receives what they must receive, to ensure that the livelihood is protected, the medical well-being is protected, everything rests on that first branch of government. And
I
so,
do agree.
so the point here, when senators start to take, you yourself have had qualms with what's his name, Saj
Yeah,
stuff for
yeah. I
bringing,
have
I'm coming,
it. It.
I'm coming for bringing buses in the country.
Yes.
He
Honor
compromises,
money. Yeah.
he compromises the MTA, the Monrovia Transit Authority.
Mhm.
But wouldn't you, some Liberians would say it was done in good faith? It kind of alleviate the burden. Yes. So it's not about the evidence. It's about the picture, the optics. What is happening? What
Yeah.
is he doing? I think let's look at it from that perspective.
Yeah. But gentlemen, I want to be human here. The senator introduced a program, and for many people who know how the legislature function, Senator Dino and the others, they have spoken out. Succeeding in the legislature is based on what they call numbers game. You can be the funniest, you can be the brightest, you can make all the, you can advance everything. When time to vote, there are people who go in the legislature with one primary objective: the ruling party must prevail. And when that time comes, it is number game. When it's time to vote, your ideas doesn't matter, or your ideas don't matter.
But let's stick to the point now.
So
Yeah.
let's do
So
that point and
so
let's
so
provide some numbers,
so
Moses.
yeah.
I will
So
give you some
yeah.
numbers.
So what I'm saying here is that the law and the others have advocated. Yes, I do agree that we need a very robust legislature that will hold the executive accountable. Unfortunately, and I know Dr. Ziah can speak to that, we have a legislature in Liberia today that is compromised. But that does not in any way imply that for those who are standing up in the legislature, we can say, oh, well, whatever initiative that they have decided to undertake is not in the interest or intended to promote themselves. And like in
So,
the case of DeLong,
Yeah, but then
so real,
you
yeah,
disconnecting
yep,
the component
yep,
of this conversation,
yep,
because
yep.
we've had this conversation. I'm coming. We had this conversation time immemorial where
yeah,
you frown on Sir Joseph that
I did.
people are doing these things because they want to perpetuate themselves in the eyes of the Liberian people so that they can hold on to the position for a protracted period. So what makes Dillon different? Why
Okay.
couldn't Dillon? I'm coming. Why couldn't Dillon go to ES Grant and say, "Hey guys, what is it that I can do here as a sitting senator to ensure that I enhance the work of ES Grant? We can take whatever we want to do and put it in your lab. You are the professionals, and let's give you the opportunity to do that." Rather than coming and doing something on his own. Is it because he's a mental health expert? Is it because he's sympathetic to the youth of Liberia? We're talking about the networking here. These people should not be taking individual projects while they are in the position when they are getting the biggest budget in the country as presented by the ambassador, and not just the ambassador, in the Liberian budget itself. That's the point we're trying to drive.
I
We're not saying
And
definitely
that,
agree. I'm not
exactly,
opposed to that.
we're not saying that
exactly, Volcano and Dr. Zia.
yeah, we're not saying that Dillon
Yep,
didn't do something well, but there was a
yep,
first way of approaching it. But
yep,
everything they want to do must be centered around them. And you
yep.
and I know it has some kind of underlying motive. That's
Yeah,
all.
And
but I
and
was just saying
and
that
Dr.
he's
Zia
been
did
fairly,
specifically say that ES
he's
Grant
been
has
unfairly
very
singled out.
doesn't have enough resources. Let me tell you, ES Grant, according to the ambassador, $7.1 million is the entire money in the budget for all of healthcare in Liberia. What did the legislators get?
65
$65
million
million
dollars.
Hmm.
to themselves.
That's a vast
Yeah,
disparity.
Yes, to undertake their own projects and to do these little things. What does the entire healthcare sector get? $7.1 million. What do the legislators do with that money? They open their own clinics. Some people decide to build roads. Some people decide to pay tuition as a way of promoting themselves and neglecting the services and the institutions. ES Grant, guess what? Somebody talked about $30,000 the other day. medical hospitals in the country, in the counties, Moses, you mentioned it the other day,
Yes.
are appropriated $100,000. What do legislators give themselves? $30,000 every quarter for development funds. What the heck is development fund that a legislator is supposed to be undertaking? Is a legislator be opening clinics and building roads? Why don't the money go to public works and other people who are supposed to do that? Or to health sectors? He has grant to provide the services. Where does that Mr. Senator Dillon even get the mental health people to operate his hospital? I want to know that.
But
Dr.
who's going
Kulah
to
just
pay?
told us that they
Who's
don't
going to
have
pay that?
enough people in the country even.
But who
So
want
they are
Well,
duplicating things just to promote themselves, period.
well, I can come in on that again. Senator Dillon set up a clinic. He has a management team. I assume he recruited individuals, and let us not put down his effort.
What
What he
not?
has initiated, I'm sure Dr. Zia can agree with me on that. What Senator
Don't,
Dillon has
don't put
initiated.
that to Ziah in the
Yeah,
picture. He
yeah,
ain't
yeah,
Liberia.
Alfonso. What yes, guys, what Senator Dillon has initiated is a laudable effort. He may not have all of the resources, he may not have all of the expertise to do it, but now what do we do? Like Dr. Kula said earlier, this is the time that we put our resources together instead of putting down. We should not be putting down. We should pull all of our resources together. Here's Senator Dillon. This is a laudable initiative. I think our national government should support the effort of the senator, and so this thing can expand. Let's use his case as a launching pad for
So Moses,
attacking the problem of addiction in Liberia.
what I would suggest we do? Let's
Eh,
discuss the Dillon's health
Yeah,
clinic.
but what I'm
I'm
saying, we're
coming.
talking about Dillon. Yeah.
Now, hold on. I don't want us to sway away from it, but let's discuss it at another time. And I'm going to hold you to it because we have
Yeah.
this conversation. But Dr. Zia, let me come back to you quickly. What is your perspective on the future of Liberia? Considering our youth and the crisis now that is being faced with regards to the social drinking and the use of drugs and the mental health condition of thousands and thousands, if not millions, of young people in that country. What is the future of Liberia if nothing is done? Because it's not dwindling, it's increasing by the day. What's your perspective? What do you see? How do you feel about it? Do you think that anything going to be done in your lifetime to really rescue our young people because they are the people who will inherit the country?
I think the response to that question is apparent. If nothing is done, we are all doomed. Not the young people, not the ones who are using drugs. We are all doomed. Because we are in a country where we clearly see that illiteracy is a problem. Not many of the people in Liberia get education up to a level to be known to be actual literates. We see that poverty is a problem, and you can look that up. There is a clear link between substance abuse and poverty. There's a clear link between substance abuse and unemployment. And we see that any group, any nation, any population where these inherent factors are poor education or poor educational status, um, unemployment, poverty is a vicious cycle for drug abuse. And we see clearly also that the availability and accessibility of substances is getting worse on a daily basis. And so drugs is readily available anywhere, anyone can grab it. And when that happens, the prevalence continuously goes up, and that means all of us are at risk of even using, because when it's available, almost everybody else around it, around us, will start using it. And you can get at a social gathering one day, and then Someone can spill things in drinks, in your drink, in whatever, or you decide to try something. And who knows if it is one of the highly addictive drug and you try that thing one time, depending on how you are made up, depending on your, your genetic makeup, one time trial, you may get hooked. And your children and their children and everybody else will just go down. Now, those who are not using become victims in other ways because the thing about substance abuse, when you have a substance use disorder, your life is based on that substance. You make every effort to look for that substance, you make effort to use it, and after using it, you are recovering from the effect. Your entire life is revolved around that. So if you don't get it because you don't have money, you will rob anybody to get it. So armed robbery is a problem. So even if you are not using the substance, you become a victim of crime and armed robbery and all the worst things that could happen. Okay. So we see clearly that if we do not, as a country, consolidate our effort to get our priorities straight, among many things, to address the substance use crisis in this country, in the next 1, 2, 3 years, what we are saying now will be even worse, 10 times worse, or even 100 times worse, because this is something that we are seeing clearly. However, the little hope we have, and we know that everything has to do with political will. Sometimes last year in June, the government of Liberia launched a project to provide care, to these substance users. They call them at-risk youth. All right, it's a program designed by government. And this program, since it was launched, the international community, including the United Nations and other development partners, have taken keen interest in devising a solution. We know that a solution for substance abuse is not one dimensional. Okay, every aspect of it has to be considered. But looking at the health aspect, they're looking at the government has launched this project and the partners are all working. We all are working together, and I'm one of those persons working on the committees, the technical working groups, to help devise plans. I am from the health background, so we would look at health programs, that can provide care. All right. But beyond that, we're looking at the issue of unemployment, we're looking at the issue of low educational attainment. We're looking at the issue of poverty. That's another aspect. It has to be addressed. We're looking at the drugs itself, the availability of the drugs. We have to look at the judiciary system, the law enforcement system. So there are so many sectors, and it has to be an interagency approach that is happening, is already being worked, is being designed. Fortunately for us, the one UN, they are into it, they are committed, and we've been working. So with time and with political will, which had seemingly been demonstrated from that launch, at least in the former program, if these things all come together, I believe that with time we can together use our expertise to design a program. But again, I'm saying we design a program. Designing a program is different from implementing the program because we know that other components come in when it comes to implementation. So I believe that we, or at least everybody in this country, knows that substance use disorder is a problem, and it is the next big thing that has happened to Liberia. And if we do not take it down, it will take Liberia down. It will take all of us down. Efforts are being made. We need to consolidate. Like Dr. Barton was saying earlier, people in the diaspora, I mean, everybody has their own life, they have their own challenges, they have their own issues going on, but we can all chip in different ways, one way or the other. Now, for example, Mr. Shelton, you have this platform, you brought up the issue for us to talk about it. Now, through this conversation, you are hearing other things you probably have not heard about the situation. We're discussing the issues, other people bringing in their perspectives, their thoughts. Other people listening will feel like, well, so this is a problem worse than I thought. Maybe I can help. And then we start talking to each other, and then we start putting together resources in the form of cash, in the form of knowledge, education, networking, all those different things. We put them together. I believe when we all see this thing as a Liberia problem, we can put together a measure. Even if it's not the best, we can start from somewhere and we can modify. But it is absolutely appalling that after all these years of war and everything, and these are all the risk factors for substance abuse. After all these years, Liberia still does not have a national program, national rehabilitation center for substance abuse. It's appalling. It's unimaginable. It's unfathomable. But this is the reality.
Yep.
And in as much as we can sit here and and complain and do everything, what can we start doing differently from today? What efforts can we put? Can we consolidate? Whom can we talk to? Whom can we link with? Who has the expertise? Who has links? Okay. And I will now drive to this part about, I know I usually try to divorce myself from politics entirely, especially Liberian politics. I do not put myself out there in any way. But I would just say for the records that substance abuse is a major problem that cannot be solved by even government alone. Not any single government can say, I will provide treatment for people who are abusing substance in my country. It's impossible. Even the US government cannot. I assure you. That's why there are agencies, there are international and local organizations. That's why there are humanitarians who donate, who contribute, who provide some help to support national effort or government's effort. And in that light, organizations that have been providing some services have to be supported. Whether they are individuals, whether they are organizations, local or international, everyone has to support. What we will, however, try to emphasize is that whatever support you are providing, let it be standardized, let it be evidence based, let it be advised by expertise of those in the field who know exactly what should be. Because if everything is in the name of, showing off that you're doing something, or getting political relevance that you're doing something, or that your name has to come up because in the next 3-4 years you want to contest, then you will not really be going for, what has to happen. You will just need publicity with nothing much being offered. So that's where I can learn for now.
Mhm. I
So,
have
Thank
a,
you
I
all.
have a question if for you, Dr. Zia and Dr. Kula. So Dr. Zia, multiple times you mentioned the issue of availability of drugs in the community, in the society, which according to you is a very huge problem. And Dr. Kula, you did mention that Azogo once said that the users are being more penalized by the justice system than the people who traffic in those drugs. So that's one of the major problems we have, is the problem of trafficking of drugs being brought into the country. Can you comment on that? Like, how are these drugs somehow showing up in Liberia, and what can be done to address that trafficking problem? Dr. Kula and Dr. Zia.
Uh, let me go first, since you tend to talk a lot and educate us a lot about stuff. But yeah, right now we have a serious case going on in Liberia where I think this is a second consignment of drugs, a huge consignment of drugs that was brought into the country through the ports, disguised as goods, I believe in the tone of $100 million or so. The case is going on. I heard there was some means they were trying to finagle the case as usual. And we've had cases like this before, whether they're either trafficked through the ports, they're trafficked through the airport by Nigerians and others. But there was one time, I believe, during the last administration where the DEA, the USDA, worked along with our NSA to do a heavy drug bust. And there's rumors that Liberia, for some reason, has become a very big hub for drug trafficking. So I'm not sure whether the authorities there are looking the other way or what. But I know one thing for sure that's happening is as our Liberian citizens and others who carry our passport are deported to Liberia, especially those that have committed, drug crimes here in this country, are deported to Liberia. A colleague of mine who lives in Jamaica, he and I discussed the same thing that's happening there. They're bringing a lot of these bad situations in country, the knowledge of trafficking and selling drugs and pushing drugs through the system and whatnot. So I think that's where a lot of the problem is coming from. The way we try to stop that is with everything in Liberia. We have to work on corruption. And where does a lot of the corruption stem from? Our people are not paid like how our lawmakers are paid. We have to look at some sort of equal pay or some sort of livable wage in our country. And then we got to look at the fact that when people are caught, they need to be punished. We have to set examples, which we haven't been good at. So it's my hope that whether it's the next government or whichever government comes into place, that we in the diaspora impress upon them the need to implement the laws effectively, because people are not going to do business with our country. People are not going to come to the country. They want tourists and others. People are not going to come to a country they don't feel safe in. They don't feel like you obey the law and that you actually implement the laws, because we have a lot of good laws on the books. We just don't implement it. So I think that's some of the issues there. But I'll let Dr. Ziah take over from there.
Yes.
Well,
Dr. Ziah, I
The-
just wanted to
yes.
ask you a question.
The question was into what to
Oh,
both.
okay. Oh, okay.
He's coming from the Liberian
Okay, go ahead.
perspective.
Well, I think this is not. It may not be like particular to Liberia. It can be about any country. You know, if you first thing we all know that drugs tend to find themselves some way somehow in countries with even a lot more effort made to prevent. So even in the US, you know that the drug laws are strict. However, drugs are still in the US. People still find ways to bring drugs to the US, to traffic drugs to the US, though difficult. So imagine Liberia where it is not as difficult. Okay. So I believe, like any other Liberian, that it is not as difficult bringing drugs in Liberia. I believe strongly so. If not, we wouldn't be having a lot of drugs popping up on regular days. Now, these huge consignments were the one that popped up, and I'll tell you clearly it was because of probably US intelligence that these things got known. Now, they mid level regular importers who bring their normal things. We don't hear about these ones, but they are bringing them. And if drugs is not available, the problem wouldn't be worsening as we're having it. And in fact, all the options in terms of the varieties of substances you have elsewhere is here in Liberia. How is it making its way here? How are these drugs making their way here in Liberia? Because there's a means. Okay, so I believe that, like I said, the solution to the problem will not be most likely to eradicate, but to really reduce drastically. It means every aspect of the government, in terms of regulation and restriction and preventing the accessibility that we are having now. It has to do with law enforcement. So DEA, NSA, police, and all the security agencies, they have to work. They have to work to do that. I know on a regular day we hear that the security sector is challenged. We hear that all the time. So maybe these are some of the reasons why we're not really being able to control, access. But the way out in reducing will be to get hard at the end where the accessibility is made possible to really try to reduce the drugs that are available in country. With that, sure, there will be one step further. Those who are already afflicted, we try to provide help for them. And these people are in different categories. There are people who are using substances who still have a normal life. Some of them in school, some of them working. They still have a normal life. We need to have programs designed for these people. There are people who are completely off, the homeless, the ones in the ghetto. They have a non-functional life at this stage. They need to be helped in a separate program and then rehabilitated, reintegrated. So a lot of things have to happen. Prevention has to be on the extreme as well. And prevention comes with knowledge to the younger ones who are yet to use it in schools, in universities. Okay, it has to be a holistic approach. It's not a one-way thing, honestly. It's not a one-way thing. And like I was saying, there are options available. There are some people who are so chronic in using substances. Like the other day, I had to meet a number of patients to screen them. Some of the guys in the street. There are people who have 32, 42-year history using substances, 25, 30 years using chronic hard drugs, and they've been homeless for all those while. They have no safety net, no family, no support system. So the problem is compound complex. It's not a one group kind of thing that you provide a solution to. So the solution has to come from every dimension, from restricting the access to adequate education to the young people, telling them about the dangers of drug, not to even try it, and then those who are already using, who are not chronically addicted, provide whatever program you can provide, maybe outpatient and other counseling program. Mostly those who are chronically addicted, provide other programs like residential program, and try to remodel them to have a whole new life. So that would be my approach. All right, and at the end of the day, all these young people who are around unemployed, they are unemployable. A lot of them are unemployable. They do not have a profession. A lot of them didn't even graduate high school. Some graduated high school and that's it. They don't have any career. Those are the kind of people that government will have to look into vocational training, industrial employment, to have them basically doing something. So it's a big problem too. And that's what I said. It's not a one person thing. It's not even a government thing. It's all of us. But the government takes the lead, provides the avenue, pull people, express the interest, that they are committed to doing this, and other people can support.
Thank you, Moses.
Yes, Dr. Zia, thanks for the in-depth analysis of the prevailing situation in Liberia with reference to substance use. Let me ask you this question. The program that was put together by the Ministry of Youth and Sports for our young people that are considered at risk. It, were you part of the team that put a budget together for $1 million to tackle this problem?
Absolutely not.
Okay.
So first thing, I'm a medical doctor and I'm a psychiatrist. I work at the
Okay.
mental health hospital, and
Yeah.
I am an employee of the Ministry of Health.
Yeah.
So I get called every now and then and get assigned by the Minister of Health, you know, to provide technical advice on a number of things, and I do that all the time.
Were you part of the
So
Were you part of the team? That's the question I put to you.
no, I say absolutely not.
Oh, okay.
Absolutely, the team that put a budget of 1 million to do a program, no. So
Okay.
firstly, I'm not even involved in budgeting. I will tell you what I can and what I have done
No.
through the mental health.
Yeah.
Sorry,
That I
through
asked
the
you this
mental health.
question. I asked you
Mhm.
this question because you are one of the experts in a country who have a profound understanding of this problem. You
Right.
know the implications. You know the causations. What need to be done? Did it tap? into your expertise to say, hey,
Sunday, in that
that
same
we want
regard,
your
let's
advice.
ask the doc if Dylan and his group either talk to them as well. That would be a good question as well.
No, no, Dr. Kula, let him respond to my question. I'm not talking about Dylan. I'm talking about the
That the
program.
facility
No,
that
Dr.
Dylan them
Kula, Dr.
established to
Kula,
help
give me a break.
with drug
That with all
abuse,
due respect,
did
Moses,
they
that,
consult
Moses,
him? That's a
yeah,
great question you need to
that,
ask as well.
Moses,
yeah,
Moses.
yeah.
Let it
I asked him
hold
a
on,
specific question.
hold
I
on,
want him
hold
to
on.
answer that.
But hold on now. You asked him
Yeah,
a specific question. He told you no. Then you follow up with
yeah,
whether the government reached out to him. It is the
yeah.
same thing
Right.
that the Kula is saying that Dylan reached out to them when he was trying to
He would have
Right.
posed
So
that to
I
him.
think I
Yeah,
can
okay.
respond to
Answer.
both
Yeah, answer.
questions
Yeah,
separately.
answer
good.
both questions. Yeah.
Separately. So the first question, whether the government, and when we say the government, the Ministry of Health is
Yes.
also involved in activities about this program. I would say
Yes.
yes. I have been working, like I said, I get consulted by the Minister of Health from time to time to provide expertise or to provide opinion and advice on a number of things. And so,
Okay.
one of the things I have done, along with
Yeah.
other psychiatrists
Good on,
and
Mama.
then the entire team from the psychiatry department at ES Grand Hospital, is to design a program. So, we clearly designed an inpatient rehabilitation program through a
Okay.
concept note that we presented to the Minister of Health, and
Okay.
she had used that and submitted to other partners. Now, the bigger program that is being developed has been using that concept we developed as a major basis for some of the things they're putting in that general program. The
Okay.
$1 million program that you talk about, I believe some of these components are included, but the budgetary aspect, as in how much did I advise or what the money is going for, or the entire monetary part, I have no role to play in it. Neither does my team of psychiatrists, my professors. We do not have any role to play in that. The other question about whether Dylan contacted me personally, I will say no. I have not been consulted personally. I'm in Liberia, so most of the things about mental health are here. Dela is not the only person providing some kind of care for substance users. There are a number of people. Personally, I have not been consulted by them to provide advice. And because of that, we know that in the absence of a national comprehensive program, you cannot question people who are doing what they're doing, because as a government we do not have a standard
Absolutely.
existing to say go by this measure. So against that backdrop, one of the things we've done, and I have advised the Minister of Health, was that we should set up a system so that anyone who's providing service will consult the psychiatrist, and we will have their program perused and assessed to see what areas we can recommend for improvement. And the goal is not to pull down anybody who's doing something to say you're not doing anything good, but we always want to provide the support where is needed. So that's one of the things we suggested. And quite recently, the Minister of Health had a committee set up to look around, see all the people who are providing services, find out what services they are providing. And I constituted a committee that had assessment to few areas to just know what they are doing. Clearly, we know that there's massive room for improvement, and we are committed to doing that. All right. These people, a lot of them are doing what they're doing out of their meager resources. And so if we want to expand, improve quality and all of that, it means there has to be a kind of support to them as well. But I think that is what it is. And I hope I responded to the two questions.
Let me come in,
Yeah.
Doctor. We will be leaving here at 9 o'clock tonight, so we have about 16 minutes to go. This has been a 2 hour conversation, and I think we're making a lot of progress here. But quickly, let's look at salary. Let's look at what you guys are paid. We hear every day that employees of the health sector is not being paid. I know I work with psychiatrists. I was in a meeting with a psychiatrist today. Based on my position here in the U.S., I have sit down in team meeting, what we call a treatment team meeting. with psychologists and psychiatrists. I know to some extent, some of them are making $15,000 to $20,000 a month. Uh, you got representatives who can barely read and write. You got senators who can barely prefer a bill, and they are making 14 to 15 grand a month. Here you are, a professional man who has worked, studied so hard over the years to acquire your degree, and is it pro bono? Are you being paid? Because one of the things I'm concerned about, when Ellen was in power, people like you who are experts, she was able to raise funds through the United Nations, some kind of international organ, to pay you specialized people so that you can be able to be paid well and do the job. Is that same? Because you have your healthcare practitioners who are committed coming to work. We know of people who come into work on a daily basis in many of the government institutions and don't get paid for months. What is the situation, sir? I know it's political, but it's also important.
And you don't
Well,
necessarily
well,
have to tell us your salary, but
Just,
just give us
well,
an idea. Yeah.
just want to know if you're
also,
making a decent way,
well.
whether it's
So
coming,
this,
whether
so
it's
Or
the
what it means to be a psychiatrist in Liberia.
so the issue of payment
I'm coming.
is
Dr. Fuller doesn't seem to feel good about it, but it is the fact. It is the fact.
no, it's okay. So I mean, I am an independent person. I don't have any political ties. I try to be completely apolitical in everything I do. And the issue about salary payment in Liberia is public knowledge.
Yeah.
There's no secret about it. It has been known from time immemorial that wages are not as should be elsewhere. And we always try to compare ourselves with the US because
And
that's that's
interestingly,
that's our brother. I
interestingly,
mean that's
interestingly,
mhm,
they harmonize you too.
well, I reserve comment on harmonization, but I would say
So,
clearly I would
so
say
an
clearly that
average psychiatrist in Liberia, how much does the person earn? That's
and
the
that
question.
means
Yeah. An
that
average
means you should
psychiatrist.
because I okay, so I'm an average psychiatrist. So by
Yes.
saying
Yeah.
well,
You're
so
not
just
average.
so you know, let me just make this clear. Payment has always been an issue. Time in memorial, salaries are not enough. People will complain over and over. Civil servants complain over and over. And when we talk about health workers, we are at the top of the chain. And so it's quite easy to talk about us. But every now and then you hear others, the mid-level clinicians, nurses, physician assistants, midwives, complain a lot about salaries. Truly, truly, if you were to compare what they make here to what maybe a nurse aide or someone else providing basic care to people in the US, I know the two economies are not the same, I understand, but that it's far, far, far away considering the kind of work they do.
just make
So
just
in
No,
make
so
general,
just
that
make
in
the
to,
I,
to
I
comparison.
make
don't
it
I
simple
don't
for
think we should
you,
push him to give any figures.
no,
I
Liberian
don't think it's
as
no,
per
so here's what
Liberian
I'm
cost
saying.
of living, the cost of living in
Right. So
Liberia,
here's
not
what I'm saying.
United States. The
So
average
in
psychiatrist
payment,
in Liberia, yeah,
right. So for payment in general,
yeah.
payment is low considering mid level, even as far as doctors.
And what would
Now,
be that
the
number?
problem now, and we should all understand this, is that in Liberia, we have a very small private sector. Now, 98 to 99% of the people, of the doctors who work in Liberia,
Mhm.
they are
Oh,
paid
salary.
by the government of Liberia. So it's not as if you have a lot of private entities paying
But that will ask you a
competitively
simple question: the
for
average
which
psychiatrist in Liberia, as per
no,
Liberian
I
cost of
wouldn't
living.
disclose. I
But
wouldn't
he's not.
disclose
I
how
mean,
much
he's
I
not going
make.
to disclose the
Yeah,
In
salary. You
general,
already
I
said
don't
we
no,
don't
want
want
to
a
I
not
don't
number.
want to
you.
say that.
We're
I
not
don't know
talking
what
No,
about
the
you.
he
Say
benefit
the
of
does.
that is.
We said we're not going to get a number from them, right? He giving you an
right,
average. They're not getting
yeah, that's
paid
what we're saying.
well. No, don't give any numbers,
He
Doctor.
said he
right. So
won't
when
give
Why
so
not?
numbers.
so the payment is not as great as it
Hmm.
should be, and then I will tell you further that because this is a problem,
Oh my
the
god.
government has recently been having issues employing doctors because every year doctors come out of the medical school, doctors come out of postgraduate program, and all these people have to be employed by the government. So that has been growing the wage bill of the government from the Ministry of Health, and it has been a concern. So that has become a problem. In addition to that, people like us who have graduated as specialists who should have been upgraded are not being upgraded. And why is that so? Because the funding, according to government, is not available. And even the batch that graduated more than a year earlier have not been upgraded. They're still being paid as general practitioners, although they've worked for more than a year as specialist doctors. So this is a situation I'm trying to let you know. I'm not going to call a figure, but it's
Moses,
general
Moses,
knowledge. It's a general public knowledge that health workers do not get paid adequately, and is a complaint everywhere on social media.
Yeah,
But
Moses, let me just say this.
Let me
There's
come
some
back to you
specialists in
quickly.
Liberia, right? There's
Yeah.
some specialists in Liberia. If you get $5,000 a month, that's a great salary. People start complaining, oh, the man making whole $5,000, right? But some of them don't make that much. They don't make up to that amount.
Not
because
at all.
everybody is working for the government. The government is not willing to pay them a decent salary. You know, that's the problem.
But you know, Dr. Ziah stated here that in salaries in Liberia, he said is what public information. Do you not hear him say that? So we were saying, not you specifically, we're just talking about an average psychiatrist in Liberia. That's the question. Not Dr. Zia's salary, I want to know. I'm saying an average psychiatrist in Liberia.
Let me put it to you this way.
Yeah.
There are two Liberian psychiatrists now.
Yeah.
There is Professor Benjamin Harris, who is about to retire.
Yeah.
And there is Dr. Ziah. This is me.
So there's no average. That means
there's no average.
Let me help you. There's
me right now, not even being paid as a psychiatrist. I'm being paid as a general practitioner now because I have not been upgraded.
Oh, but that's bad though. That's wrong.
Let's just leave it like that, Moses. So
you got a malfunctioning in different capacity, and you're paying for something else.
Moses, the company is harmonized. So,
I wanted to.
I'm sorry.
Volcano,
it's completely fine. It's fine.
Yeah, I want to say something real quickly again about. I wanted to go back to Dr. Ziah.
Let's just watch the time now.
Yeah, no, I'm not asking a question. Dr. Ziah being able to share his contact, and I think Mr. Sampon has been posting a lot, talking about himself and his work, and also his wife's work. And I would like them, if it's possible, for them and Dr. Ziah to make contact to see what can be done on the ground, including Dr. Kulah as well, because again, that's one of the objectives of this program.
And Seattle Townsend, mental health.
Yeah, so Seattle, if you can post your contact, if you all can get together, I think that would be great. This program will have accomplished something really significant. So I want to encourage you all to, either share your information with Volcano or post it somewhere where, you all can get in touch. That's what I wanted to say. Thank you.
Thank you. So, gentlemen, we're about to wrap up. We got 7 minutes to go. So let's go around the room quick, and just ask one more question each. And that question can be the start of Alphonso. Let's just start with you quick.
Yep.
Not one part 2 and part 3, just one question.
Yeah. I know.
Because remember, it's 1 o'clock. It's about 1 o'clock in the morning for that.
Yeah, I know. And doctor got to go to work So Dr. Ziah and Dr. Kulah, real quickly, in a few seconds, what do you see as the solution, or do you see any solution at all?
Let's start with Dr. Kulah. He's the solution man.
Yeah, I see solutions. I see solutions right here. Somebody said earlier that talking about the problem is, in a way, a beginning of trying to find solutions, because we have to first identify the problems, right? And Dr. Ziah has done a great job. That's why I love to hear him speak about issues in Liberia. He used to have a show I used to follow.
You're fading out. You're on mute. You muted. You mistakenly muted yourself. Good. Go ahead.
Okay. Yeah, we start with first discussing the problem, identifying the problem, which these shows do, shows like this do, and Dr. Z has been great at telling us about some of the problems. And then what we need to do now is go a step further and start finding the solutions. And you have helped with starting to find the solution by networking. So if we can get Sienna Townsend to connect with Dr. Zia, get some point, and I believe the doctor that went to Liberia, Dr. Simpson, psychologist. Was that Simmons? We need to get in touch with Dr. Simmons, because if we can start here as a group, Moses, Sandy, Alphonso, Shelton, you are in mental health as well. All of us as a group, individual, and let's take one thing and do something about it. Like Shelton, whatever it is that you work in mental health, perhaps you can start mentoring somebody in Liberia in that particular field. Dr. Simmons can help with you trying to connect her facility with Grant and trying to see if we can bring somebody here. We can start looking at different grants that perhaps one of these facilities can write and connect with a grant. I know I have an in-law married to my niece who's a psychiatrist. He's into child psychology and all of that. Psychiatry rather. I'm going to try to connect with him and see what he can do after he gets settled with Grant. So each one of us takes something and do for Grant so that we can build Grant up to where it needs to be to provide the services to our people. It's not enough with just identifying the problem. It's not enough with just criticizing the issues in Liberia. Somebody asked whether Liberian doctors just go straight to the hospital after they graduate. Initially, what it used to be 1 year they would do an internship and then they will go to a hospital. But since 2013, they're now doing like we do in America. You go to a residency program, whether it's 3 years or 4 years or 2 years or what have you. And then after your residency training, which basically you're a house officer, you're in the hospital all the time and learning and seeing the problems. Then you go out on your own and become what is called an attending physician. Now you get the problems on your head and whatnot, which Dr. Zia is now. So let's all help in some way to solve some of the problems that were raised here tonight. Thank you for having me.
Thank you. Dr. Zia, quickly, I know that you're coming, but something came to mind. Considering the ES Green, how much space is that hospital seated on? So if you even wanted to expand, because I can imagine how, everybody has built in the annexes all in the alley. And so when the days of the Catherine Mill Hospital, it was acres and acres. In fact, it was the only facility in all of that land space. Mm-hmm. Today, ES Grant is, I believe, is kind of sandwiched in a bubble by all of these structures, makeshift structures around it. Do you have space to expand if you were to do that within the
No. So Catherine Mills used to be a 90-acre land. 30 acres were fenced in, and that's where the hospital was, although it expanded to 90 acres. Right now, the hospital, ES Green Mental Health Hospital, is a rented property.
Mm-hmm.
It's owned by the Grant family. I said it was a private practice. Mm-hmm. So it's owned by the Grant family, although his wife, his family still manages the problem, and JFK pays rent every year. And I think it's on like 2 lots of land.
2 lots.
We need to do something about that.
Wow.
So I think that space is about 2 lots, maybe 2 lots or just a little over 2 lots.
Less than that. Wow.
And so it's a tight space. There's the JFK administration have been doing a lot of little work, fixing things here and there. But first thing, they don't own the property. Secondly, they can't expand any further. So the home is not Grant.
Is it expandable airspace wise? Can it be extended?
But even if it was,
that's what you're saying, the private property. Yeah, they can do it.
No, there's that much that can be done. The future of mental health service in Liberia is not Grant. It's
Okay.
far from grant.
Yeah.
There has to be a mental health hospital built in Liberia.
Okay.
And it's not
That
grant.
was my question. Moses, your quick question before we go.
Yeah, no. Really, I don't want to make. I don't want to ask a question. I just want to make a comment.
Go ahead.
The problem of mental health in Liberia is a profound problem. And I'm sure both Dr. Zia and Dr. Kula can speak to that. We agree with me on that. It's a profound problem. We have our political leaders that are disinterested, and maybe I'm sure Dr. Zia can also either confirm or deny this. To have
Dr.
a
Hick.
country where you have $30,000 allocated on an annual basis for mental health, then where do you go to that?
Exactly.
So you're
Nowhere.
not asking a question, Moses. We gotta-
Yeah, I'll just leave it like that. Where do you go with $30,000 mental health? Where do you go?
Dr.
Dr.
Sia,
Zia works for the government. Stop asking those kind of questions.
Dr. Sia said it clearly that he's not going to be in politics. But listen, Dr. Kula and Dr. Zia, we want to thank both of you for joining us the other night. I don't know if you have time. We have a segment in the broadcast that is called "What Type of Country Is This?" where we point out to some of the things that are common to our country that is particular to Liberia, and maybe you could contribute. You can stay here with us and hang out a little bit. We got only 50 minutes to do this, so we'd like to do that while you're here, and maybe you will see. So Moses, what type of country is this? We want when
No,
the government of the country only allots $30,000 for mental health, but
yeah.
you have more than 2 point something million youth suffering from mental health. What
What type
Yes.
of
type
country
of
is this?
country
What
is
type
this?
of country is this?
Mhm.
What type of country is this that the government appropriates only $100,000 an entire year for each hospital in each county, and they can't even give them a penny of that money? What
Mhm.
type of country is this?
What type of country is this when you have lawmakers on an annual basis earning $65 million untaxed, and the average Liberians are taxed 25% of their income, especially those who work for the U.S. government? What type of country is this? Public officials don't pay taxes, but ordinary Liberians are paying taxes. What type of country?
What type of
Income
country is
taxes.
this? What
Income
type of country
taxes.
is
What
this,
type of
Moses?
country is this?
What type of country is this that when a psychiatrist sits here in the studio and cannot even disclose the average salary of a psychiatrist because he's the only one? What type of country is this? Alfonso,
You got Dr. Zia cracking.
what type of country is this?
Dr. Kula, what type
Because,
of country is this?
because
Let
there's
Dr. Kula
right because there's Moses, Moses there's no average because
What
these
type of
There's
country
nothing to
is
average.
this that you go
Yeah.
through war? You got everybody that's been on drugs, and people are crazy doing all kinds of stuff, and you cannot put money into healthcare, into mental health, especially.
Yeah.
What type of
Yeah.
country is
Country is this?
What type of country is this that every
Dr.
legislator and government official opening their own clinic and hospital, and the public hospitals and clinics can't even
in
have the
shambles.
money to operate and serve the people? What
That's
type
the
of
thing you
country?
gotta add. Don't just say that. You gotta add.
What type of country is this?
But what type of country is this? Dr. Zia said something that was very profound. And the reason I asked that question, he said, don't look at the youth, but look at the entire country. If nothing is done, the entire country is doomed, including
doomed.
you
What type of
yourself.
Yeah, what
Yep.
type of country
And
is
what
this?
type of country is this that the government, the president, all of the officials in the government have not seen that this issue of mental health can
It's a
crumble
problem.
the country? What type of country is
Country is
this?
this?
And to really support what Dr. Zia said, that Akula mentioned, 63% of Liberia population is less than 25-year old.
Mhm.
So if the
That's true.
young people are impacted, the whole country is actually impacted. That's 63% of our population, younger
Mhm.
than 25.
What type of country is this where substance use, including alcohol, has just become a way of life? everywhere you turn, there's a liquor club. I mean, there's a liquor shop. There's a nightclub. People can barely go to sleep. Accessibility. A 12-year-old can go buy alcohol. What type of country is this?
What type of country is this?
Yeah. What type of country is this that a country that doesn't produce the drugs is overwhelmed by any and every kind of drug in the whole wide world?
Mhm. What type of country is this?
Yeah.
What type of country is this that the ambassador got to always frown on the government and its inability to take care of its citizens? What
Yeah.
type of country is this? And the man said, I'm not leaving from here until you fix the problem. People don't call him back. He said, I'm going to do my counter tour. What type of country is this?
And you made me very want to go back. I would tell the entire Congress about what's going on.
Whatever country it is where the U.S. ambassador has become a nightmare for the leadership. Whenever the name of Michael McCarthy is called, somebody is looking over his shoulder.
What type of country is this that the only public mental health hospital in the country, the capacity of that hospital is only 70 to 80 people?
Wow.
What type of country is this?
What type of country is this? A country of 5 million.
5 point something million. So only 70 to 80 people can be treated.
Can be hospitalized and treated at a time.
Wow.
Thomas, why'd you say, what type of country is this where you have more drinking spots than healthcare centers?
Yeah.
Yep.
What type of country is this?
What type of country is this?
What type of country is this? 5 million people, only 2 psychiatrists. 5 million to 2 psychiatrists.
Psychiatrists.
And that's why you
3
get
psychiatrists.
Three psychiatrists.
What's the ratio? Can anybody calculate the ratio?
But there's
I mean the ratio that 1.5. Oh,
no, there's no ratio, my man.
one man to 1.5 million.
Interestingly, because there are only 3, we can't know the salary.
You know, we get people. Can you imagine, my man? 1.5.
1.8 million. Each psychiatrist get 1.8 million people to treat. Jesus Christ.
Shaggy McAfee is back. He says, what type of country is this hashtag that don't teach you have to say turn left here, or turn right here, but rather bend here, bend here.
Yeah, that's what we used to say.
He confused the American people. Bend here.
Yeah.
No address system to this day. What type of country is this that has no address system, no street signs, no numbering of houses, nothing? What type of country is that?
Yeah, you look very sleepy. You don't have to be here.
Volcano.
No,
That Dr. Kulah
you
was
muted,
saying, right?
You muted.
Yeah. I'm muted.
No, Dr.
I'm good. I'm enjoying it. I'm enjoying this.
Okay.
You want listen, you
You want no trouble.
Yeah.
you
So Dr. Kulah was saying, what type of country is this? you have no a structured mailing system. So if you want to go somewhere, you say, my man, where you lay? Oh, my man, you get to that junction, just say that rail on me. What I see was
the hall with the rest thing, you just bend behind it and you see
you
the
say, my
winner
man, just say,
market.
Joseph, man. I live in right under that big plum tree.
Yeah, here's a nice one. Here's a nice one. Here's a nice one from let me get this quick. From Alexander Sampon. What type of country is this hashtag that Dr. Ziah is just quiet?
Oh, Dr. Job is on the line.
Dr. Ziah is just quiet. What
Well,
type of-
not really. My job is not.
We just
on the line.
kidding.
I
We
just
just
I
kidding,
choose to
Dad.
be a professional all the time. And
Yeah, you're right. Yeah,
you
we
know, every
just
time you
kidding,
start
Dad.
discussing the issues and the issues behind the issues,
Yeah.
people think you're being political, and I
Yeah,
just
you're right. Yeah,
it's to
you're
be
right, Dad.
misinterpreted like that.
Yeah.
But what kind of
Because, yeah.
country that doesn't have? What kind of country does not have a rehabilitation center
That's
where
a very
drug
good
abuse
one.
is covered?
Can you imagine, my man?
Yeah.
Wow.
Rehabilitation
That's a powerful one. Let me
after Civil War, my man.
let me say that again.
Yeah.
What type of country is this? Dr. Ziah says that does not have rehabilitation centers. Not even centers, but a rehabilitation center.
After 14 years of Civil War, my man.
What do you mean after 14 years? After 30 years, because I war already, my man.
I'm talking about. I'm talking about the time the war is set to again. You know, but man, we have no rehab.
Dr. Ziah, what's the address to ES Grand Hospital?
no. Let's go on Dupo Road and ask for
You see the sample.
When you start going to Borough past the graveyard and see the sample and turn on
You said, man, you see the sample.
You're right.
Not the first sample, the second one, but the third one I read.
You see it there.
So Samuel Abu says not all of the 5 million people are psychiatrically compromised. So the 1.8 that we said, but my man Samuel Abu, you haven't gone to Liberia. Everybody compromised. The doctor said it. He said the whole country is in serious problem.
But Samuel, we don't wait until we diagnose people before we provide them doctors. The doctors, that's why we create ratios.
I mean, what type of country is it that you have young people sleeping in graveyards?
What type of
country is this?
Yeah,
Unimaginable.
Modernity. What type of country is this, Shaki McAfee? When the president says we will not be spectator in our own country, we will be on the field playing. The last I checked, only Lebanese and Chinese people playing on
the field.
Elites.
The Liberian elite.
What type of country is this?
Yes. What type of country is this? He comes back and say, where is it at? Thomas Awaji, when a car kills a dog, the people fight over the dog to eat it.
What type of country is this?
What type of country is this by Kwashi Hayes? When the doctor is ashamed to call it a salary. I'm my guess. I beg you.
So
But why Moses kept pushing for the message? What you want to do?
No, I said the average. I didn't say Dr. Zia's salary. I said the average, and that said, look, my man.
But the man
said
already
average.
told
We
you
are
the
only
only
3
three in the country. Then he said average.
He said, and the number I gave you, my man, that would be it.
But listen to this. Philip Besa says, what type of country is this that is still renting a 2-lot land to cater to mental health issues in the country?
Oh my God.
2 lot.
Yeah, 2 lot.
2 lot.
Somebody house.
Man, we need help, man. We need to help our country. We need to do something better.
Well, if you get $30,000 in the whole national budget for the whole year for the entire country, that's why you have to settle down for $30,000. Are you crazy? It can't even run one.
So Moses, I know that.
Yeah,
Alja, I think we can make this proposition here, and I hope the president is listening. Alja raises money for media, but we can also do something just for mental health and give, if they're even low, $500 to $1,000 we can raise and give it to the hospital. That can help with, fuel for the generator, or something. At least it'll be a contribution by,
Yeah, it sounds good, but like you said, it's something that can be discussed behind the scene.
Yeah, but I'm putting
the leadership.
Now. So
it sounds
we'll
good.
vote for you to be the president.
We'll usher you in.
Our man already took another job and died.
So we'll vote for you, Avocado. Yeah, but that's something that maybe the leadership can begin to ponder over and see, if, because we have done a lot touching the media.
So Dr. Kulah and Dr. Ziah, my work is to work with resident physicians. So I do work with resident physicians in New York State who work for the New York public health system, which is practically the largest public health system in the country. And as you know, Dr. Kulah, residents come from all over the world, and so I interact with them. So I'll get your contact as well.
Are you interacting with them in public health or mental health?
So every sphere of their work. What I do is I work for the union that represents them, negotiates their salaries and
Oh
benefits. So
wow, okay,
yeah, yeah.
wonderful, wonderful.
So I will contact you all to see what we can do from to help.
Sure, sure. That
Yeah,
sounds great.
I think there's room, yeah, I think there's room for collaboration.
Okay.
Speaking about some of the things you can do, like this publicity you're doing now is awesome.
Mhm.
Dr. Kula talked about it earlier. That we have been doing some radio programs before. These are very important. So those are some of the things we can be doing in our own ways, and
Yeah,
keep
to
talking about the
highlight the
drug
problem.
problem, keep
Yeah.
talking to the young people about the effect of drug, keep telling them about the danger of drugs so that they can already know not to even venture into that. So
Mm-hmm.
those are some of the things, some of the little helps we can provide. In Liberia, if it's not politics, there's no support, you know. So those are small things we can all try to support.
Yeah.
And, and what you journalists could do is try to put a real life spin on all of these things and show how politics affects everything. The fact that politicians are not funding mental health in Liberia is causing a serious problem, like Dr. Zia explained. And politics affects everything in our life, everything in the country. Because
Yeah.
a group of guys are going to sit there at the legislature after the president and his finance minister put the budget together. They have to sit down and decide who gets what. And mental health, healthcare, it's a big slice of that issue. At least should have a big slice of that pie. Education should have a big slice of that pie. All of it is politics. But most importantly, a friend of mine told me that a lot of young people in Liberia are dying from cirrhosis of the liver from alcohol abuse. That's something serious that we need to talk
See
about.
that?
And I think quite recently, there's a young guy that died. He was either a musician, I think Brittini or one of those guys. And I think that's what he had, if I'm not mistaken, cirrhosis of the liver. So we have to be very careful with the alcohol abuse in Liberia.
Yeah, and it's so pervasive, man.
So, doc, any nurses trying to become psych professionals, even though there's no psych program in the country?
Before the postgraduate program started training psychiatrists,
Mm.
the organization called Carter Center has a mental health program that provided training for several nurses. It was more like a crash course, a 6-month crash course to provide basic care for people with mental health problems. I think they trained over 300 of those people. I think it was around since 2010 thereabout. And those
Okay.
people were providing care or are still providing care while we are training higher level, care providers like the
No, yeah.
psychiatrists. Now, there are a number of psychiatry residents. We expect about 3 additional psychiatrists this year in the subsequent year. So, we keep producing the number and hopefully things will get better. A new program has recently been launched by one of the local universities here to train nurses, physician assistants, and midwives as advanced practice or psychiatric practitioners,
That's
basically,
good.
to provide some level of training. To provide some level of care around. So yeah, that's a new program. Is the curriculum was just developed. It was just finalized. So hopefully soon they will start having extra training for those people. So
And do
That's
they
those
good.
have people in the country who will be training those people? Like
yeah, there's a mix is a mix of national, locally based trainers like ourselves, psychiatrists, and then there's some faculty that will be coming from out. There's one of the local universities here that has launched that program. So we in mental health supported them to develop the curriculum to make sure that everything is there. So they will be bringing, faculty, and those on ground will also provide some care.
Okay.
Thank you. All right, so we're leaving now. Thank you so much for the night.
Thank you, guys.
It was great conversation. Thank you, Doc, for staying up with us
Great
tonight.
being on. Thank you.
Yeah, we will circle back at some
Thank
point
you.
because the crisis is not going away.
No,
Um,
it's not.
so I will contact you, Dr. Zia, momentarily to talk off the record. And as I said, once I visit Liberia, I will do everything to stop by as grand. The last time we couldn't because too many things were happening, but this time around, I will make sure that I come by, just to see what's happening. But thank you again for accepting our invitation and being with us this late. And for you, the same, Dr. Kula. Thank you so much. We will take leave of you. Any final word from you, Dr. Zia, since you're on the grounds?
Well, thank you. It was a very nice conversation, and I try to always keep it professional and away from the
Yeah,
politics because
yeah,
that is the issue. The politics will always be around, but the issue is the issue, and so I try to stick to it. But it was
that's true.
very interactive, and I like the different
Yeah,
angles that
perspective.
everyone brought in. It made it great, and I'm grateful that you invited me here. I'm
Thank
always
you.
available, and thanks to our listeners.
Thank you.
Thank you for
Thank
having
you.
me. Yeah.
Thank
Thank you.
You there.
Thank you.
you. Thank you.
Yeah,
Thank you.
Dr. Kula.
Yeah, thanks for being on, guys. I enjoyed it, and let's try to find some solutions, each one of us, and implement it. Thank you. Have
Sure.
a good evening.
Yeah, yeah, thank you.
Thank
It
you.
was a
Thank you.
pleasure.
Yeah.
Yep. Okay.
Volcano, someone say you can get his contact.
All right.
Yeah.
Let's see. But gentlemen, that's it.
That's it.
Right.
Yeah, it is what it is, man. Thank you. It was a pleasure being
Thank
here.
you. Thank you, guys. Volcano, you gonna take Moses on that issue?
Oh,
Building
what's that?
road vessel, building cleaner.
Oh, we are live,
Not
right?
now. I'm
Yeah,
just
yeah,
joking.
we're live. Yeah, we're live.
Mhm.
Oh, I'm sorry.
Okay. Leaving now. So